Aloha, everybody, and welcome to the latest edition of the Weekly Dose. I'm Brooks Baer for the Department of Health, and let's jump right into it today. We've got a wonderful guest. He's got all kind of information to share about COVID, about variants, about vaccines. Let me introduce to you Dr. Tarquin Collis. He is the chief of the Department of Infectious Disease at Kaiser Permanente, Hawaii. Dr. Tarquin Collis, thanks so much for your time.
No worries. Thanks for having me.
It's wonderful to have you here because I want to talk about the effectiveness of the vaccines. I want to talk with you about what's happening with these frightening variants and what the realities of those things is. But first and foremost, I'd like to talk about long haulers. We're really hearing more and more in the last couple of weeks about the long-term effects of COVID-19. And that's frightening stuff.
Yeah, it really is. I think it's a side of the pandemic that doesn't get talked about much. I think there's a lot of focus, understandably, on sort of hospitalization on the one hand and death on the other. But in clinical practice, a lot of what we see are folks who do suffer in fairly prolonged fashion from even after a fairly mild disease. So I think that's a good thing to talk about because I think it's kind of underreported and yet it's really important clinically out there, especially for young folks to know about.
So what is a long hauler? I mean, what are some of the effects that someone can suffer for not weeks, but months on end?
Yeah, it's an interesting thing, Brooks. It hasn't really yet been formally defined as a clinical syndrome. So we're still sort of wrapping our arms around what exactly constitutes being a long hauler. It's called different things, by the way. You'll see in the literature, PASC is a new term that's really probably going to get formally defined. I think it's post-acute sequelae of SARS-CoV-2 infection is the fancy name for it, PASC. You can look at it that way, but long hauler is sort of what they've typically been called in the US. And what it really refers to, even though it hasn't yet been formally medically defined, are folks who are well outside of the window of acute COVID infection and yet have really lingering symptoms. And that can be very variable. It can vary both between people and it can vary even in a given individual, sort of what they experience over time. What we're seeing really most typically is folks who have a variety of problems that usually have to do with either fatigue, brain fog, so issues around mental clarity, a lot of sleep disturbance, and then a fair number of sort of anxiety, depressive type symptoms. The numbers in terms of how frequent those symptoms can be in someone who has been infected are pretty variable. The biggest study is looking as far out as a year, which is about as long as the pandemic's been around, suggest maybe 1 in 10 folks who have had COVID may have symptoms that are still residual at the 1 year mark, which is quite remarkable. It's a lot higher if you're looking earlier. If you're looking 1 to 2 months out, it might be 30% of people. There's a lot of interest in the overlap between this PASC or long hauler syndrome and what we used to call chronic fatigue, or is now called myalgic encephalomyelitis. Something that people are familiar with. I think chronic fatigue syndrome, something that's been talked about after Lyme disease or mononucleosis or a lot of other infections. It could be that what PASC or long hauler syndrome is about is some relationship, some relative of something we already know about, chronic fatigue, or it could be something quite new. There's a lot of interest in further research on it. The NIH has just granted about a $1.2 billion grant to study long haulers over the next 4 years, which is great. I think we'll get a much better insight as to what that really represents. There's an interesting study that just came out in the VA, from the VA literature in Nature, a great journal. It's probably the biggest study so far looking at long haulers, and it was a study of about 73,000 VA patients who had not been hospitalized and had followed them over time to see what their symptoms were like over the 6 months after their infections. And they found some pretty disturbing things. They found that the death rate among folks who were never hospitalized, who had COVID and who had persistent symptoms was about 2.3%, about 60% higher than folks who didn't have COVID. And they found actually quite high use of opiates for pain, medicines for anxiety and depression in that group as well. Again, these were men in their 60s, mind you, which might not be representative of all folks who have had COVID for sure, but as a subset of the population, they really suffered and they had higher death rates. So that's one of the early signals we're starting to get that this is more than just a symptomatic issue, that it's actually, one that has really serious long-term consequences for some folks' health, even if they never were in the hospital in the first place.
Okay, so, the 60-some-year-olds are becoming long haulers, but young people are too.
Absolutely, we're seeing quite a bit of this in our outpatient clinics. It's quite impressive, and in fact, there's definitely some folks who've had COVID and who were super sick and in the hospital, and what we're dealing with in those folks are clearly defined physical problems with lung scarring, et cetera. But there's a lot of people who had very mild COVID. In fact, a subset of people who are totally asymptomatic, who have what seem to be long haul syndromes that are quite disabling for them. And I talk about this a lot with folks who are vaccine hesitant, who are young, because I think a lot of younger folks, with good reason, say, why should I get vaccinated and deal with the sort of trouble of going to a vaccine center and maybe feeling sick for a day or two when my risk of death is so low. And I tell them, hey, you're right, the risk of death is very low, but let me tell you, the risk of having a significant set of symptoms that make you feel pretty lousy for many months is not low at all if you catch COVID. And so it's really worth preventing. And I think it should be a point of real education emphasis as we try to look at folks who are younger, who may be a little reluctant to get the vaccine.
The prospect of long haul COVID, even to a youngster who might suffer the effects for as long as a year out, maybe even more, we don't really know because COVID hasn't been around all that long. And you're saying maybe 10% have some sort of ill effect for up to a year. Yeah, that is frightening. So is there any kind of early treatment you can do to someone who is infected with COVID that can kind of reduce the effect? Or is really the best treatment prevention by wearing a mask and not getting COVID in the first place?
Yeah, I think that the studies that are starting to look at treatment, and there's a bunch of treatment centers both in Europe and the US that have sprung up, have really not shown us yet a clear path towards feeling better, with maybe one interesting exception, which is that vaccination itself in a subset of folks with long haul syndrome seems to ameliorate their symptoms. There's a really interesting website called Survivor Corps that for folks out there who are interested and who have had COVID and want to look at a resource that's focused a lot on education. Survivor Corps did a survey of folks who had COVID, quite a large survey, and they found that about 43% of folks who had COVID and had long haul syndrome or symptoms and were vaccinated felt remarkably better after vaccination, which is an interesting signal that we don't really understand yet. There's a large study in Yale starting up now looking specifically at that, looking at patients who had long haul symptoms who got vaccinated and seeing how they did and what changed in their chemical parameters in their blood to try to understand that, because that does seem to be one of the few things we can offer right now is, ironically enough, vaccination against the bug that caused this. But other than that, we really don't have anything great to offer, and even those data are pretty preliminary. So I can't emphasize enough how important it is to avoid COVID, both by the means that you've talked about, distancing and masking carefully, and maybe overwhelmingly, more importantly in a way, is vaccination.
Well, how about these vaccines? What about the Pfizer, the Moderna? This is your specialty. How impressed are you by these products?
I tell you, Brooks, it's like a moonshot to have these two vaccines, this vaccine class. When they first came out, nothing in medicine is like 90 or 95% effective. I spend my day treating all kinds of infections, and it's rare that we have something that's that effective, either as a treatment or preventative, and yet they have proven to be just miraculous. And we know a lot about them. I mean, we've done well over 100 million doses now in the US. We have a good sense of their safety profile, and we're starting to get longer and longer term data. That the CDC, as you probably know, just released their analysis of the first 77 million vaccinated folks in the US, and they looked for breakthrough infections. In other words, infections with COVID in people who were fully vaccinated. And it's incredibly rare. I mean, their number was about 1 in 10,000 patients having breakthrough infections. And the risk of death after vaccination from COVID was less than 1 in a million. I mean, really remarkable. Both Pfizer and Moderna, separate from that, released their own 6-month data recently, their top line results looking at the continuation of the trials that formed the basis for their emergency use authorization back in December. And they looked at all of their folks at the 6-month mark. And again, 90 to 91% effectiveness even 6 months out from any symptomatic infection, and 95 to 100% with both vaccines against severe disease. So it is such a gift horse that we have these vaccines. They're just out of this world in terms of efficacy, and we know their safety profile at this point remarkably well. So I just can't emphasize enough how important it is for folks who haven't gotten them yet to really consider it and go out there and get safe.
Yeah, doing themselves a favor, and they'll be doing everyone a favor in the long run. And being a layperson, the more science I read from people like you, the more I am impressed by what these drugs can do. Something else that impresses me is the research that has gone into the variants. We're all becoming kind of living room backdoor scientists, because we're all kind of learning all these little things that we'd never heard about before, right? A variant, these mutants that come out. Well, we've got the latest numbers. The Hawaii Department of Health State Laboratories Division has now detected a total of 555 cases of variants across the state. In just 2 weeks, that's an increase of 209 variants. The B1429, or what people often call the California variant, is the most prevalent. There are 429 cases of the B1429 statewide. 207 of those cases are on Maui, 184 on Oahu. And then just this week, more cases cropped up on the Garden Isle, on Kauai. And they had just one case up until this point. So there's the B1429. There's its sister variant, the B1427. We've got that here. That's another of those California variants. And then the UK variant, the South African variant, the Brazilian variant. They're all here. What's the concern, and what does this mean as far as achieving herd immunity?
Sure, I think it's worth taking a step back and sort of asking, what is happening exactly with these variants? As an infectious disease doc, as a guy who's sort of virology trained, none of this is super surprising, right? This is a virus of bats, and it's adapting slowly to humans, and it's making the changes it needs to do to do well in humans in terms of spreading from person to person. And it's also facing a landscape in which there are new vaccines at play, and it needs to figure out how to evade those. And it's a pretty wily guy. And, in a lot of the world outside of the US especially, cases are exploding, which is the way that, that's the playground that viruses need to really evolve. And so it's no accident that these are arising in places with a lot of uncontrolled infection. And that included California for a good chunk of the fall. I think what they really represent over time is nature's natural selection of viruses that are a little more fit in the human host. And the California variants that are here, the 1429 and 1427, they have a mutation, the L452R mutation. And pretty clearly, these are variants that are a little more transmissible from person to person, and also a little more resistant to neutralization antibodies that we have in our bodies after either vaccination or natural infection. I think they are much less scary than some other variants of concern, I suspect, over time, but they're very real. And I think what they really mean over time is that the game changes under our feet when you're dealing with a pandemic. It shifts under your feet and you have to adjust. And it makes the importance of vaccination even more crucial, because you need to protect yourself against a virus that's a little more easy to catch and a little worse for you if you catch it in many respects. So it increases the need for vaccination, and it means that the numbers of folks that need to get vaccinated in order to achieve herd immunity, which is really when the community itself is protected against infection because so many people are immune, the more infectious a virus, the higher percent of people that need to get vaccinated to achieve herd immunity. So variants represent a more infectious virus, and the importance of vaccination, not just for yourself, but as a part of a community that you're participating in, and that you have some obligation actually to others to help protect them, becomes even more important.
Yeah, the runaway cases that we're seeing in places like Brazil and India, they become a breeding ground, I guess, for these variants. And
Yeah.
as you know, there can be no mutation without replication. And so as the virus is allowed to spread from person to person, it has just that many more opportunities to mutate and to become something even more dangerous. So, and maybe after we take care of Hawaii, we've got to focus some more around the world, because this is a global problem.
Oh, it sure is. I mean, I think if there's ever been, you know, if we ever needed more clarity that we're all interconnected, right? Something that happened in maybe a wet market in a southern Chinese city has suddenly come to dominate the world. I mean, we don't need that much. We don't need to look too far afield to understand that even as we speak now, what's happening in India and Brazil represents a real threat. No matter how you look at that politically, if you just feel like America first, totally fine. If you look at it as a global obligation to help others, I think either way, whether it's self-interest or global interest, it's really important to help get folks vaccinated outside of the US in order to really make us all a little bit safer, because whatever happens in Sao Paulo will ultimately come back to affect us. It's a pretty small world nowadays.
Dr. Tarquin Collis, infectious disease guru at Kaiser Permanente, I really appreciate the time. I'm glad we interconnected with you today.
Me too. Thanks a lot for having me, Brooks.
Wonderful information. Thanks again, Dr. Collis. We appreciate it. Folks, before we say goodbye, one last bit of business. We do this every week for you. We recap the number of doses we received in Hawaii through the Department of Health this week, and then we look ahead to next week. So this week, the week of April 19th, through the Department of Health, Hawaii received 72,220 doses of COVID-19 vaccine. We're going to see a slight increase come next week. We are expecting 72,820 doses to come in to Hawaii through the Department of Health. We expect also that the federal retail pharmacy program is going to get perhaps as much as 20,000 or so doses, and that goes to the pharmacies around the state. So look, you just heard Dr. Collis talking about a lot of the reasons why it's a good idea to get vaccinated. If you're still on the fence, talk to your physician about it. Talk to people who've been vaccinated, and check out the facts, because I think you'll find that the facts support that the vaccine is just a wonderful tool in ending this horrible, horrible pandemic. And if you want to get vaccinated, we encourage you to go to hawaiicovid19.com. Look in the upper right-hand corner for the registration tab. Click on it, and you will see options, hopefully in your community, maybe even at a pharmacy near you where you can be vaccinated. Dr. Collis and his colleagues at Kaiser Permanente have administered tens of thousands of vaccines. We thank them for that, and we thank you for your attention and for all you have done, Hawaii, in really keeping Hawaii relatively safe compared to other places around the world. So good job. Let's keep it up. You know, we're not at the finish line, but I think I see it coming. So keep it up, Hawaii, because we've all got to work together to get there. We're not there yet. All right, everyone. Great spending time with you again. Thanks again to Tarquin Collis, and we'll see you again soon here on the Weekly Dose.